In this episode of our Clinical Series podcast, we will be discussing the topic on stroke or cerebral vascular accident. Welcome everyone. Today's lecture revolves around an important medical topic that affects millions of people worldwide, stroke or cerebrovascular accident, CVA. We will discuss the various aspects of stroke, including its definition, risk factors, clinical presentation, signs and symptoms, treatment, prevention, and dietary considerations. 1. Definition. A stroke, or cerebrovascular accident, occurs when there is a disruption of blood flow to the brain, leading to reduced oxygen supply and subsequent damage to brain tissue. This can be caused by a blockage, ischemic stroke, or bleeding, hemorrhagic stroke, in the blood vessels supplying the brain. 2. Risk factors. Several risk factors contribute to the occurrence of stroke. These include high blood pressure, smoking, diabetes, obesity, high cholesterol levels, sedentary lifestyle, family history of stroke, age, especially for individuals over 55 years old, and certain medical conditions like atrial fibrillation or heart disease. 3. Clinical presentation. The clinical presentation of a stroke may vary depending on the affected area of the brain. Common signs and symptoms include sudden onset of weakness or paralysis on one side of the body, difficulty speaking or understanding speech, aphasia, visual disturbances, severe headache, dizziness or loss of balance, and loss of consciousness. 4. Early signs of stroke. Recognizing the early signs of a stroke is crucial for prompt medical intervention. The acronym FAST can help identify these signs. Face. Ask the person to smile and check for facial drooping. Arms. Ask the person to raise both arms and check for weakness or numbness on one side. Speech. Ask the person to repeat a simple phrase and check for slurred speech or difficulty speaking. Time. If any of these signs are present, call emergency services immediately and note the time the symptoms started. 5. Treatment and prevention. Management of stroke includes immediate medical attention in a specialized stroke unit. Treatment may involve medication to dissolve blood clots, in the case of ischemic stroke, or surgical interventions to stop bleeding, in the case of hemorrhagic stroke. Rehabilitation is vital for stroke survivors to regain lost functions. Prevention strategies focus on the management of risk factors mentioned earlier. This includes regular blood pressure monitoring, smoking cessation, maintaining a healthy weight, controlling diabetes and cholesterol levels, engaging in regular physical activity, and managing other underlying medical conditions. 6. Dietary considerations. A healthy diet plays a significant role in the prevention and management of stroke. Emphasize a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Reduce salt intake to control blood pressure and limit the consumption of processed foods, saturated fats, and trans fats. Encourage moderate alcohol consumption, if any, and promote hydration for optimal blood flow. In conclusion, stroke is a serious medical condition with potentially devastating consequences. By understanding its risk factors, early signs, and symptoms, as well as implementing preventive strategies and adopting a healthy diet, we can significantly reduce the risk of stroke occurrence. Remember, time is of the essence when dealing with a stroke, so act promptly and seek medical help immediately.